subscribe. This is PART-4 myself Srija. So today you are going to learn about the ICD-10-CM coding guidelines for diseases of the nervous system. So in this video you are going to learn about how to code the diseases related to the nervous system. For example, how do you code the paralysis? So how do you code the hemiplegia, right? So first coming to about dominant and non-dominant side. So when you have to code for the diseases related to nervous system, then you have to first think of about what is the dominant and what is the non-dominant side. Yes. So some ICD-10-CM codes in the G81 and G83 categories. So what they describe about the paralysis or weakness on one side of the body. So these conditions include hemiplegia and also the monoplegia. So when conditions like these, so when coding these conditions, you must identify which part of the body is affected and whether the part is dominant or non-dominant, whether it is used more or whether it is used less. So what does a dominant and non-dominant mean? Dominant side is nothing but the hand the patient mainly uses, usually the right hand, and the non-dominant side, the other hand, so which we do not use regularly. Because dominant affects function, ICD-10 codes must state it, right? So what happens if the doctor documents the side but not dominance? So if the record says, so which side is affected, whether it is left or right, so but does not mention the dominant or non-dominant, so the coding rules help you to choose the correct one. For example, when the patient is ambidextrous. So what do you mean by ambidextrous? Nothing but they use both hands equally. Right, you call them as ambidextrous patient or ambidextrous human, right? So in the case of ambidextrous, you have to always assume the affected side is dominant. So the second one, if the patient's dominance is not documented, so what you have to do? You have to use two defaults. What are they? If the left side is affected, it is automatically the non-dominant one, right? Because we do not use the left side more or left hand or left leg. So when the right side is affected, you have to take default as dominant because these are the standard clinical assumptions. Most people are right-handed, right? Yeah. Coming to this picture shows the hemiplegia. So what do you mean by hemiplegia? Hemi means only one side of the body. Plegia means nothing but paralysis. So hemiplegia means a paralysis of one side of the body. So a blood clot blocking flow to part of the brain is called as paralysis. So this damage, it leads to the hemiplegia. So if the right side of the brain damages, so what happens? The left side of the body gets paralyzed. So in this slide, you have to remember that you have to identify which side of the body is weak or paralyzed in order to code for dominant or non-dominant side. So you have to check if dominance is documented. If not, by default, you have to take right side as dominant and left side as non-dominant. When coming to ambidextrous patient, you have to always consider the dominant. So this helps to select the correct ICD-10-CM code for conditions like hemiplegia and monoplegia. So this is the first guideline. So coming to next guideline about pain. So pain, what is the category of the pain? G89 series. So ICD-10-CM category G89, it is used for different types of pain. So when the pain needs extra detail beyond the main diagnosis, you have to use this general coding rules. So what are they? Let's go into the rules, right? So rule 1, you have to use G89 codes along with the other codes. Okay. So G89 codes, this should be used in addition to the other codes or other diagnosis codes to show acute pain, chronic pain, cancer-related pain, post-surgical or post-trauma pain. So, but only when the documentation clearly states these details, right? Whenever it states these results or these details, you have to code. You have to give this G89 codes. So, if the type of pain is not specified, you have to not use G89 at any cost. So, if the doctor does not mention like acute pain, chronic, post-thoracotomy or post-procedural or also cancer-related, you should not assign a G89 code. Just you have to code the underlying cause if known. This is the rule 2. And coming to rule 3, you should not use G89 if the underlying cause is known unless the purpose of the visit is pain management. You got it right? If the doctor already knows the exact disease causing the pain, then you have to code the disease. So you have to not use the G89. So do not use G89 unless the patient is coming only for the pain management. So when the person comes only for the pain management, if the pain management is the underlying disease, then only you have to use this G89. If not, you should not use the G89 if the cause or reason for the encounter is a pain management. So for example, a patient with a non-spinal fracture comes only for the pain medication. So you can use G89 in this case because the visit is for pain control, right? So next, coming to rule 4. So if the visit or procedure is to treat the underlying condition, if the visit or procedure is only to treat the underlying condition, you should not use G89. If the patient is admitted for surgery to fix the problem, for example, like spine surgery, like fusion or chiroplasty, so then you have to code the real disease, for example, like fracture or stenosis. You should not use G89 again over here because the goal is to treat the condition, not the pain. So you have to remember these. If the pain is clearly described as acute, chronic, or cancer related or post-surgical, you have to use G89 code, right? So category G89 codes as principal or first listed diagnosis. So G89 codes describe different types of pain, as I said you, acute, chronic, cancer related, post-surgical. Sometimes these codes can be used as the main diagnosis. So this depends on why the patient is visited or being admitted. So when G89 should be used, can be used as a principal diagnosis. So there are some rules when it has to be used as a principal or first listed diagnosis. So let's go into it. So the main reason, when the main reason for the visit is pain control or pain management. So for example, when a patient has severe back pain due to a disc problem, so he comes only for the steroid injection to relieve the pain, then you have to code G89 code is first, because the primary purpose of the visit is to treat the pain but not the disc disease. So you are getting my point. When the patient is also admitted for the insertion of neurostimulator for pain control, again this is the pain management, right? So a neurostimulator, what it is, it's a device which is used to manage the chronic pain, which is used to manage the long-term pain. So here if the patient comes specifically for pain control using this device, then you have to use this G89 as a principal diagnosis. So when G89 cannot be used as a principal diagnosis, so it should not be used first if the main purpose of the visit is to treat the actual disease causing the pain. So whenever this patient has pain, but his purpose of visit is not to treat the pain, but is to treat the actual disease. So in that case, G89 cannot be used as a principal diagnosis. It should be used as a secondary. And the underlying disease must be the principal, right? So when the patient is admitted for the surgery to fix the underlying problem, like for example, if a patient is admitted to treat the spinal stenosis. So what do you mean by spinal stenosis? When the spinal canal is narrowed. So you have admitted to hospital to treat it. So during the same day, a neurostimulator is also inserted for the pain relief. So in this case, it cannot be coded as the principal diagnosis, right? So in this case, what happening? Underlying condition is spinal stenosis. So this has to be coded as a principal diagnosis. And the pain code G89 must be the secondary diagnosis, because the main goal is to treat the disease, not the pain. So this is about how and when you have to use G89 codes as principal and first listed diagnosis, right? So coming to next one. So use of category G89 codes in conjunction with site-specific pain codes. So sometimes one code alone does not give you enough information, right, about the patient's pain. You have to give 2 to 3 codes sometimes to give the proper explanation about how the patient is feeling, about what he is feeling actually. So this ICD-10 allows you to use G89 codes and also the site-specific pain codes. So what is G89 codes? They are used to describe the type of pain, whether it is acute, chronic, or post-operative, or also cancer related. And what does the site-specific pain codes indicates? So they used to describe whether the pain is located at which part at which position on the body, right? Like whether it is So whether it is located on your back, whether it is located on your knee or abdomen, etc. So you have to use both codes together. So when each one code adds about the important information. So when to assign both G89 and site-specific pain codes. So you must use both. When the site-specific code tells you where the pain is, for example, low back pain. Here, the record shows you it is situated at the lower back and they are telling you the what type of pain it is, right? So you have to use both the G89 and the site specific pain codes. And the other example, the G89 code tells you more details about the type of pain, right? Whether it is acute or chronic, whether it is short-term pain or a long-term pain. So this G89 code gives the missing detail. For example, a patient has chronic low back pain. So what the code you have to assign about chronic low back pain? M54.50. It is low back pain, right? So this tells where the pain is. And G89.29, this is other chronic pain. So this tells the type of pain is. So you have to give a proper coding like where the pain is and what the type of pain is. So in these cases, you have to use G89 with site-specific pain codes. So this site-specific code does not mention whether the type of pain is, right? So you have to assign both, one for site-specific and one for what is the type of pain. So if one code tells where and the other code tells what kind of pain. So this is the reason why you have to use both in conjunction. So next, coming to sequencing of category G89 codes with site-specific pain codes. So in previous slide, you have learned how to use and when to use and why to use in conjunction, right? So now you have to learn about the sequencing. So when you are using G89 codes, when you are assigning G89 with site-specific pain, so which code should be assigned first or which code should be given as a principal diagnosis? So let's see about it. So sequencing means nothing but which code should be written first and which should come after. So this order always depends on why the patient is visiting, the reason for encounter. So rule 1, if the patient comes for pain control or pain management, then what you have to code? You have to assign the G89 first. Because if the main reason for the visit is to treat the pain but not the underlying disease, then you have to code first G89, the type of pain, and second code you have to give the site specific pain code where the pain is. For example, when my patient comes for a pain management for acute neck pain due to trauma, so you have to assign G89.11 for acute pain due to trauma first, and then M54.2 for cervicalgia, the neck pain, as second. So why? Because the visit is specifically for pain control. Okay, this is a rule 1. So coming to rule 2, if the visit is not the pain control and no definite diagnosis is known, so how do you code? It is not for pain control. So clearly you have that idea. So you have to code the site specific pain first. Because if the patient is coming for any other reason, not the pain management, and the doctor has not yet confirmed an underlying condition, you have to first code the site specific pain code. So where is the pain? And then the type of pain, G89 code. So when we take an example, when a patient comes with chronic knee pain, so diagnosis is not yet confirmed. So how do you code? M25.561 code for the pain as first, and then G89.29, the other chronic pain as second. So because the purpose of the visit is not pain management, only evaluation. So this is about how do you sequence G89 codes with site specific pain codes. So coming to post-operative pain. So what do you mean by post-operative pain? The pain that occurs after surgery, right? So this ICD-10 coding rules decide when and how to code this pain. So coding depends on what the doctor writes, so how the doctor records it. So you should code post-operative pain only if the provider specifically documents it as such. If it's not clearly documented as post-operative pain, you should not assume it, right? So what is the default rule for coding post-operative pain? if not specified as acute or chronic. If whether the pain is not specified as acute or chronic, by default you have to code as acute. For post-operative pain and post-thoracotomy pain, so pain after this chest surgery, if the doctor doesn't say whether the pain is acute or chronic, so use the acute post-operative pain code, because acute pain is the usual form right after the surgery. So after the acute, there comes the chronic, right? So this is the acute pain is the usual form. Then by default you have to assign the acute pain only. So do not code routine or expected surgical pain. So after surgery, it is normal for patients to feel some pain, right? So this expected pain should not be coded. You have to code post-operative pain only when it is above normal, or whether it is complicating the recovery or not, or the provider documents it clearly as a diagnosis. So then you have to do not code the routine or expected surgical pain. For example, when you have to not code if a patient has mild expected pain on the first day after surgery. It is expected, right? So you have to not code it. When you have to code it, if a patient has severe post-operative pain requiring a special treatment, so you have to code it as a post-operative pain. So doctor must mention the post-operative pain. If they don't say acute or chronic, the default is acute. So normal after surgery pain you should not code. So only the complicated or significant post-operative pain should be coded. So this is about the post-operative pain. So post-operative pain not associated with the specific post-operative complication. So what do you mean over here? When coding a post-operative pain, you must decide whether the pain is linked to a specific surgical complication or not. So this decides which ICD-10 codes to use. So coming to A, the post-operative pain not associated with the specific complication. So this means the patient has pain after surgery, but there is no specific problem or complication identified. So what you have to do? You have to code the post-operative pain, right? So for example, when the usual post-operative pain that is more severe than expected. So pain after surgery, but no documented cause like infection, bleeding, or dehiscence. You have to code G89, the post-procedural pain codes, like G89.18 for other acute post-procedural pain and G89.28 for other chronic post-procedural pain. So you have to use acute or chronic depending upon the doctor documentation. So coming to B, the post-operative pain associated with the specific post-operative complication. So A is not associated and B is when it is associated. So the pain is directly caused by a specific surgical complication, right? So for example, when a pain due to a painful wire sutures. So when the pain is caused by the post-operative infection. When the pain is from the nerve surgery during surgery, nerve injury during surgery. So how do you code? You have to code first the complication. So from chapter 19, the injury, poisoning and other consequences of the external causes should be coded as the first, as the principal diagnosis. And then you have to add an additional code from G89 to specify either it is acute or chronic post-operative pain, right? So this shows both the complication and pain due to the complication. This is about the post-operative pain, when it is associated and not associated with the complication. And then coming to the chronic pain. So what is chronic pain? Chronic pain is a pain that continues for a long period, right? But ICD-10 codes does not specify an exact time frame for chronic pain, like 3 months or 6 months. We do not have any exact time frame for chronic pain. If it continues for a long period, then it is a chronic pain. So the provider's documentation decides whether the pain is chronic or acute. So what is the coding rule for chronic pain? It is coded using subcategory G89.2. For example, G89.21, chronic pain due to trauma. G89.22, chronic post-thoracotomy pain. So what is the important point over here? You should assign a chronic pain code when the doctor clearly states the pain is chronic. So in this, at the right side of the slide, you are finding the picture of the chronic pain cycle. So this image shows why chronic pain continues. So pain, it causes anxiety, right? So anxiety makes the brain more focused on the pain. So then body makes the changes in the nervous system. So then this leads to more pain, and more pain leads to more fear and less movement. So the cycle continues. So this explains why chronic pain needs the long-term management. So then coming to neoplasm related pain. So you have to code G89.3 code. So when you have to use this code, when the pain is related to cancer, when it is associated with a tumor, or due to primary or secondary malignancy. So this code, it works for both acute and chronic pain, right? So when you have to use this neoplasm related pain as the principal diagnosis, you have to use G89.3 as the first listed code. When the main reason for the patient visit is pain control or pain management due to a cancer again. For example, opioid adjustment, nerve block, or palliative care. So what is the additional coding rule? You have to always code the underlying neoplasm separately. For example, G89.3 is neoplasm related pain, right? So C50.912, malignant neoplasm of the left breast. So C50 code supports the cause of the pain, and G89, it is used as the pain control or pain management. So when to use G89.3 as an additional diagnosis? So if the patient comes mainly for treatment of the neoplasm itself, for example, chemotherapy, radiation, surgery, tumor evaluation, and the provider also documents the cancer-related pain, you have to code G89.3 as a secondary diagnosis. For example, when a patient admitted for chemotherapy for lung cancer, so he reports cancer-related chest pain. So you have to code Z51.11 for chemotherapy, C34.90 for lung cancer, and G89.3 for neoplasm-related pain. So there is no need to code the site of the pain separately. So you do not have a code to add a code for the pain site. G89.3 already indicates the pain is due to a cancer, which is enough. So you do not have to separate again the pain, the R related series again. It's enough to give G89.3. It already indicates the pain. And sequencing instructions. So what is the sequencing instructions? You have to use G89.3 as principal diagnosis only whenever the encounter is for pain control or pain management due to neoplasm, due to cancer. So this is about the neoplasm related pain. So coming to chronic pain syndrome. So here coming to chronic pain syndrome, there are two specific conditions, G89.0 and G89.4. So what is G89.0? It is a central pain syndrome, means a pain resulting from damage to the central nervous system. Whereas G89.4, it's a chronic pain syndrome, a complex condition involving a long-term pain, psychological factors, behavioral impact, and also impaired daily functioning. So how it is important? These are not the same as simply having the chronic pain, right? So you have to use G89.0 or G89.4 only when the provider specifically documents either it is a central pain syndrome or a chronic pain syndrome. So you do not assign these codes based on the assumptions. Only when the provider specifically documents, then you have to use these two codes, right? So this is about the chronic pain syndrome. Yeah, that's it for today's session. In the next session, you are going to learn about the introduction to ICD and CM classification of diseases related to the nervous system. So in the next video, you are going to learn how the ICD and CM codes are classified into how many types and how they are classified, how diseases are classified into different zones. You are going to learn, right? Thank you.